Catholic University Nursery Career, Valencia Aro Kerli. More about factor H autoantibodies in membranous nephropathy. Definition: membranous nephropathy is a kidney disease that affects the filter of the kidneys and causes protein in the urine, as well as decreased kidney function as swelling. It is one of the most common causes of the nephropathic syndrome in adults.
Here is a disease which we may not be able to totally show just on light microscopy, and it's usually diagnosed much better by electron microscopy, but nevertheless, let's look at it a little bit. This is a kidney. Here's a blow-up of a glomerulus underneath. In this case, this glomerulus, in fact, the whole tissue was stained with PAS. The tissue on top is a regular H&E stain. You can see some small glomeruli out here. You can see a whole bunch of tubules. And you don't see too much by way of diseases within the tubules. In fact, in all honesty, if all you had was a light microscope and a H&E stain, you might not think there was much going on in these glomeruli either. However, when you do a special PAS stain, periodic acid shift stain, PAS, in this disease, you can see deposits of immune material in the basement membrane, which cause quite thick. And if you were lucky enough to have access to electron microscopy, excuse me again, you will notice that the thickenings in the basement membrane are somewhat spiked. You cannot appreciate it just from this PAS stain, however. Nevertheless, membranous glomerulonephritis is associated or caused by a variety of things, and in adults, it's one of the most common causes of the nephrotic syndrome. Thank you very much.
Application in nursing. B cells in the production of autoantibodies in membranous nephropathy combine with the adverse effect of alkylating agents, corticosteroids, and calcineurin inhibitors, increasing amount of the observational data on the effectiveness of rituximab have emerged.
GN is the abbreviation for glomerulonephritis. It's a long word, but in essence, these are the group of diseases which affect the kidney. GN is a condition which affects the filters in the kidney, and these filters can either get inflamed acutely, and in that case, it starts spilling the blood and the protein in the urine, or there is a slow process in which the kidney filters can get scarred and the waste products cannot get out of the body, and they start accumulating in the body and have negative health effects. The symptoms which make someone seek medical attention is generally swelling of the legs, sudden weight gain, patients noticing foaming of the urine, that the urine is very bubbly. That is indication that there is protein. Blood pressure suddenly spiking up, having a new rash, with having the bubbly or this foamy urine. Those will be some of the symptoms which someone immediately contact the healthcare provider to see if they are developing inflammation in the kidney or glomerulonephritis. The GN clinic at Mayo Clinic is a multidisciplinary clinic of nephrologists who are the kidney specialists, the nephropathologists who are the pathologists specializing in kidney disorders, radiologists. We have the help from the nutritionist and the immune system doctors, the rheumatologists. So when a patient is referred to us or patient calls us with the symptoms which look like they may have GN, they are immediately seen by the nephrologist. The patient is evaluated to see if we can determine the cause of GN by the blood and the urine test, or whether someone needs a kidney biopsy. Then the biopsy is done promptly so we can get to the diagnosis and the cause for glomerulonephritis, and then tailor the treatment specific for that patient. Sometimes we are able to offer certain research trials, which are the cutting-edge treatment for the patients with glomerulonephritis. So the autoimmune disorders are generally lifelong disorders. So you have to manage them, control them. Sometimes they go into complete remission, and patients may not have the symptoms for many, many years, and then they may start coming up with the symptoms. So those patients need to be long-term monitored for relapse or making sure that the kidney function is stable. The other thing I would like to point out is that once the damage has happened to the kidney, that damage is generally not reversible in most of the cases. So the key thing is avoiding further damage to the kidney and maintaining the kidney function so a patient can have adequate lifestyle and the health status. These GN conditions can lead to kidney failure, especially if they're not diagnosed early, or the treatment fails to control the inflammation. The kidney function can progressively decline, and patient may need dialysis or kidney transplantation. And some of these conditions can recur in the transplant. So having a transplant at a center where there are expertise for the GN is critical.
Pros: complement factor H and promote the elimination of deposits from both the subendothelial immune complex and the subepithelial immune complex. Due to the low performance of cyclosporine, the Mentor study suggests that rituximab should the recommended alternative agent of the treatment of membranous nephropathy when kaolin agents are not suitable. Cons: calcineurin inhibitors no longer seem suitable as the first-line agents for membranous nephropathy, although they can effectively reduce proteinuria. High relapse rates after withdrawal make them poor treatment option. Its use should be strict to situations in which other medications are not able or contraindicated.
Chronic kidney disease develops when your kidneys start to lose function. It can happen gradually or very quickly, so knowing its cause can help you get the right treatment from the start and help keep your kidneys healthy. Diabetes is the leading cause of kidney disease. When diabetes is not controlled, or when a person has diabetes over many years, excess sugar that gets into the bloodstream damages the blood vessels, which leads to decreased kidney function. High blood pressure or hypertension is the second most common cause of kidney disease and is responsible for about 28% of kidney failure. If left untreated, the blood vessels in your kidneys that carry blood throughout the body can be permanently damaged. The good news is you can care for your kidneys by controlling your blood sugar and blood pressure. Kidney disease is not contagious, but it can run in families. So if one of your family members has diabetes, high blood pressure, or kidney disease, you could be at risk and should tell your physician at your next checkup. To learn more about the causes of kidney disease, visit davita.com.
Issues apply in Ecuador. The prevalence of kidney disease in Latin America is 650 patients for each million inhabitants. We can increase estimate 10% per year between 25 and 45 years old. In approximately 80% of cases, membranous nephropathy present with a nephrotic syndrome.
So IgA nephropathy is one of the commonest causes of kidney inflammation in the world. It predominantly affects young adults, and at the moment, despite this disease being known about for the past 50 years, we have no treatment for this condition. It's a condition that can result in end-stage kidney disease, requiring young people to need dialysis or a kidney transplant. And what's particularly disheartening about this disease is even if a patient receives a kidney transplant, it can come back in that transplant and lead to the loss of that kidney transplant and the requirement for that patient to go back onto dialysis. So this trial is trying to determine whether a new drug called LMP-023 is useful in treating IgA nephropathy and whether it is safe. It has never been used to treat IgA nephropathy before, and therefore it's unknown what dose of drug is going to be effective and safe. And so the design of this study allows the sponsor to test different doses of drugs to determine which of those drugs are likely to be useful, and therefore to continue with those doses in a second or third phase of the study. So in terms of an adaptive design, this is the first study we've actually undertaken that's been an adaptive design. All the other studies we've done have been the traditional phase 2 or phase 3 design. So I think this approach of an adaptive design is that it streamlines the trial process. So for instance, we have been involved here in Leicester in the Part A, so the first phase of this study. We are comfortable with the design of the study and delivering the study, and therefore when we move on to the next phase, there won't be the long setup, the time it takes to get used to the drug and the study. We'll have already been through that process for Part A. We will seamlessly move into Part B, albeit testing different doses of the same drug, but we will be able to move much more quickly into testing that drug in a new set of patients. So we were very proud with this study to have recruited the first global patient. I think that's really a testament to our strong relationships in Leicester with the UK-wide IgA nephropathy patient community. And again, because I'm very interested in IgA nephropathy, it's very pleasing to see that the UK was the joint top recruiter to this study, which I think is going to be a pivotal study of the use of complement medications in IgA nephropathy.
Conclusion: membranous nephropathy is one of the most common causes of nephropathy syndrome in adults. It's a pattern of glomerular lesion characterized by the thickening of the glomerular basement membrane due to the deposition of subepithelial immune complex.
Hi, my name is George McKenzie. I'm not a doctor, but I have had a lot of kidney problems through the years, and I've learned a lot about the different types of kidney disorders. So I've created this video to help anyone who may suspect they're developing a kidney problem and would like to learn a little bit more about this topic. Chronic kidney disease stages define the progression of a serious and potentially life-threatening kidney problem. Chronic kidney disease, or CKD. Chronic kidney disease stages range from stage 1 to stage 5. The higher the number of the stage, the greater the progression of the disease. Chronic kidney disease is a progressive condition that develops over an extended period of time. It can be decades before symptoms begin to present themselves. By the time symptoms are noticeable, a large percentage of kidney tissue may have been destroyed. There are many possible reasons behind such damage. Chronic kidney disease stages are useful diagnostic tools for doctors who can treat their patients based on the stage their kidney disease has reached. Doctors use a measurement called the GFR to determine how efficiently your kidneys are functioning. GFR is an important factor in determining chronic kidney disease stages. Stage 1. Damage at this stage is regarded as mild. A GFR of 90 to 100 is typical. At stage 1, you won't even know there's a problem, and it's likely there will be no symptoms. At stage 2, filtration rate is lower, ranging from approximately 60 to 89. You probably still won't have any symptoms, but kidney function tests would begin to detect abnormal protein levels in the urine. Now, admittedly, most people don't pay much attention to the texture of their urine, but when there's more protein than normal, it will sometimes look foamy, and foamy urine is a good reason to talk to your doctor. Stage 3. When chronic kidney disease has reached this stage, you may notice changes in the pattern of urination. You may find you have to get up at night more often, and a certain level of fatigue and weakness may begin to appear. Some occasional cramping, dry skin, and generalized itchiness may occur. Tests might show that you have anemia. A GFR test will give you a reading between 30 and 59 at stage 3. Stage 4. Fluids begin to accumulate because chronic kidney disease has lowered the ability of the kidneys to perform their normal filtering functions. Symptoms may become more numerous and prominent. At stage 4, you need the help of a nutritionist with your diet, limiting your phosphorus, potassium, and sodium. Urinary output will decrease and you'll feel generally unwell. At stage 4, your doctor would start to talk to you about the possibility of kidney dialysis. GFR would read between 15 and 29. Kidney function, by this time, has been seriously compromised. Stage 5. This stage is critical, and kidney failure is imminent if it hasn't already occurred. Symptoms of chronic kidney disease are obvious and may include nausea, vomiting, noticeable swelling and bloating, and almost no urine production. At stage 5, the kidneys have basically stopped working, and patients would either need kidney dialysis or a kidney transplant just to survive. Chronic kidney disease is often discovered by accident because your doctor is treating you for some other disorder. Individuals with hypertension or high blood pressure or diabetes are often more prone to develop chronic kidney disease than those who don't have these conditions. So your doctor may want to run kidney function tests if you have hypertension or diabetes. There are also certain risk factors connected to chronic kidney disease. If you smoke, if you're obese, or you are more than 65 years old, your chances of developing CKD are higher. CKD is also more prevalent in certain demographic groups, especially African Americans, American Indians, or Asian Americans. Finally, you should be vigilant if you have a family history of kidney problems. When CKD is diagnosed in the early stages, mainly stages 1 and 2, the progress of the disease can be slowed with medications and lifestyle changes. In many cases, however, it's impossible to reverse significant damage to kidney tissue that has already taken place. This video was created to give those who are not medically trained a basic understanding of this topic. Here are 2 books that offer additional in-depth information about kidney health. Click on the links in the YouTube About section to learn more.